Hey guys, welcome back to Respiratory 2160. Today we are going to have a series of videos discussing introduction to ventilators, mechanical ventilation. Exciting. So we're going to start with two ventilators I'm going to show you today. These are Puritan Bennett. This one is the Puritan Bennett 840 and this is the Puritan Bennett 980. This is the older version. This is the newer version. They're both excellent pieces of equipment. A lot of the hospitals in this area use these two machines. And I'm just going to start by showing you the basic mechanics of it. Then we'll go into maintenance, and then we'll start with initial settings and functions. So I'm going to start with the Puritan Bennett 840. Again, this is one of our older ventilators, but excellent. It's a workhorse. It's one of my favorites. I love it. Let me come over here. So we're going to take it apart, and then I'll talk you through putting it together. When you're setting up a ventilator, this circuit comes in one bag. So we're going to take it off, and I'll show you how to put it on. Right here is a lock. When it's down, it is locked. When it is up, it is unlocked. And this piece of equipment right here comes out. This is called the expiratory filter. This filters out, I think they say 99.9% of any viruses, bacteria, any type of pathogen, and prevent it from getting into the ventilator, spreading to other patients. And also down here is a water trap that, as you can see, it can come off here, any condensation, and be drained out right here. If we turn the vent around, just as with any piece of respiratory equipment, we are electrically and pneumatically powered. One thing that makes this a little bit different from the V60 is we have to have both an air and oxygen connection. Remember, oxygen is green, air is yellow. This is so that we can have adequate flow in order to run our ventilator. And then on the front, we have, you lift up this little piece of plastic, we have our on-off switch. Up here we have a row of buttons, which we'll go over when we talk about settings. And then our screen, and then the body. Sometimes you will see large battery packs, which are down here, so that the ventilator can run. Typically each battery lasts about 6 hours. So first I'm going to show you the two types. There are two types of circuits that are commonly used. We have what's called a dry circuit, and then a heat and moisture circuit. I'm going to first show you how to set up the dry circuit, and then the humidified with a heater circuit. So you'll pull your circuit out of the bag. So let's take a minute and pause and talk about what type of patient we would place on a ventilator that does not have a heater. This would most commonly be used for patients that are ventilated for short periods of time, such as post-operative patients or possible overdoses, somebody that's going to be intubated maybe overnight, not for weeks on end. And I'll show you why. So we start at one end and move to the next. Say you pull it out and you think, I'm not really sure which one goes where. The one with the 90-degree elbow is your inspiratory limb. The straight is your expiratory limb. Over here is your inspiratory flow valve. Sorry. And it will say to patient, and there's an arrow showing right here. Next we take a filter. This is also a viral filter that's also 99.9% effective to block against bacteria and viruses. You first place the bacterial filter right here so that we can both protect the patient and the equipment for future use. Next we take, remember, the inspiratory limb that goes to the patient. Remember, the patient's breathing in, and we hook it to the viral filter as such. One thing to be cautious about: if you feel a leak, this little cap can come undone. There's a little cap right here. It can come undone. Just be careful of that. That's a common occurrence. We follow our inspiratory limb up, and we come to what we call the Y. This is called the Y of the ventilator. As you can see, it's kind of shaped like a Y. So if you hear something referred to as the Y, this is what it is. This is where the inspiratory and expiratory limbs meet in order to connect to the patient. So our inspiratory limb comes up and meets at the Y. And then we have our one single connection right here that connects to our patient. So think about it this way. If we have a patient that is being ventilated with a non-heated circuit, it's similar to putting your head out while flying an airplane. There's a lot of flow, a lot of air coming at that patient. Our lungs are not dry sacs. We need humidity, we need secretions, we need some type of way to keep those lungs moist. And I hate myself for using the word moist right then. This piece of equipment right here is called an HME, or heat moisture exchanger. It has a little filter in it which allows the patient to exhale. When we exhale, we have humidity. This humidity allows the lungs to stay moist, and it captures the humidity so that we can have those to keep our secretions loose. This will stick just right at the end. Sorry, that's a little confusing. Like that. And then this little elbow helps to seal it so that our circuit stays clean and we don't introduce any infection to our patient. So it can also be used with certain adapters, but most of the time I use this as a cap, so I cap it. Next we go to our expiratory filter, which when we go to the humidified, it'll be a little easier to see. Our expiratory filter, we take our expiratory limb, we take our expiratory filter. You go so that this part is pointing out. There's grooves right up here on the top. You slide it in, and then you lock it with this little limb that locks. After that, you take the big port right here, and stick it on. Okay, that's how you set up the circuit for a non-heated ventilator. We're gonna hook that, and we're gonna switch these out. Because we're now gonna talk about the differences with a ventilator that has a heater. Okay, I'm gonna hurry and take this apart. I'm sorry, guys. Part of being a respiratory therapist is being really good at tinker toys. We'll kind of do it so that I don't drop it on the floor. So just as with the 840 or any other ventilator, we have a connection from the ventilator out to the patient, except this time we still place our viral filter, just as with the non-heated. Stick it right there. And then we have this short piece of corrugated tubing. This short piece connects to the inspiratory from the ventilator. And then what's different, there we go, is we hook it to the heater. These heaters are a little different than the Fisher Paykells that you guys have used before. This is called a concha, and it draws the water up differently to allow for humidity to occur. You stick it to one end of your concha heater, which then slides into the heater here, because how we talked about the metal on metal with the Fisher-Paykel, that's where the heat occurs, is the metal on the metal. Same with the concha. So water goes into here, into this cylinder, and then there's metal in here. We slide in to allow for humidity and heat to occur. From there, we have our inspiratory limb right here, which is blue. Inspiratory limbs are blue, expiratory limbs are white. This one's really nice. So we have our inspiratory limb, we come down, and we have little collection cups that will collect any humidity or sometimes secretions or blood sometimes occurs. And we have a suction that we apply to here, and we can suck those secretions and humidity out. Come up, we meet at our Y, and this is where we can connect our ballards or inline suction to our patient. You always want to try to keep the inside of the circuit as clean as possible. We come along the expiratory limb, our little cup, and then attached to our expiratory filter, which is located right here on the 980 ventilator. One thing it's huge, and sometimes will give you problems, is the heater wires, which are wonderful. Let me show you. These attach to the heater because it's ran by the heater, and they're also attached to the ventilator circuits. So one connects to the back right here by the heater, and basically it's just matching colors. So blue to blue, and then follow the circuits. This is with the conchas. So this short piece attaches to this heater probe. There's a little hole here, and you attach the heater probe here. And then there's a longer piece that attaches up here at the Y, so we can tell what temperature is occurring right by the patient. This is all connected at the bottom. There's an attachment here that comes out, maybe. That helps monitor the heat. It's here at the bottom of the heater right here. That's one thing that makes it a little different, these conchas from the Fisher-Paykel, is the heater wires are set up a little bit different. Inside of the circuit, there are wires. These are disposable, the wires inside the circuit, and they help maintain the heat, the temperature, the humidity within the circuit. Okay. And on the 980, over here you can see your battery power packs, how full they are. So each battery should last roughly 6 hours, but just keep an eye on it. Always make sure your ventilator is plugged in. On the back here, we have our air and oxygen. Our electricity, remember, always plug it into a red outlet. And that's it for equipment setup of a ventilator. Next, we are going to talk about SST, or system circuit test, and then initial settings.